When we get older, we forget things. That's normal. We may forget where we put our keys. We may forget names. That's all part of a normal aging process. But what isn't normal is forgetting how to use the keys. My name is Gitlin. I'm a distinguished professor and the Dean of the College of Nursing and Health Professions at Drexel University. I have spent the last 20 years designing programs for people living with dementia at home and also their family caregivers. So dementia is an umbrella term that refers to a wide variety of conditions. And the most prevalent type of dementia is Alzheimer's. As we age, the biggest risk factor for any type of dementia is age. With our aging population, we're seeing an increase in the prevalence of people who have cognitive changes. Some people refer to the rapid changes in our demographic situation that we have what's called a tsunami, but that's actually not accurate. We do have a swelling of older adults because of the baby boomers, but a tsunami retreats and is over. And when I say the new normal is that we will have if you want to say an imbalance or more older people than younger people, that's going to last for the next 50 to 100 years. In the United States in particular, the expectation is that a family member will provide support to an individual living with dementia. The question is, are they ready? Are they prepared to do what we expect them to do? And the short answer is no. At the time that a person receives a diagnosis, that's all they receive. The family member isn't necessarily informed about the disease process, what to expect, where to go for help. Basically, you're on your own. So at this point in the United States, we do not have a system by which the family is assessed in terms of whether they have the requisite knowledge and skills, the time, the ability, and the finances to care for someone with dementia. If I had my way, we would have to redesign healthcare because right now healthcare is based on an acute care model. That doesn't fit in the new normal, which is an aging society. You have to understand health from a lifespan perspective. Aging just doesn't start at the age of 60, 65, 70. Aging is a lifelong process. The kinds of care, the lifestyle choices, the access to education and healthcare from the time one's born impacts, honestly, how you age. One of the risk factors for dementia is poor education. And that doesn't start when you're 50 or 60. A factor that can reduce one's risk for dementia is being bilingual. That has to start right away. So we're all connected from a lifespan perspective. And so every student in our college has to understand the new normal is that they are part of an aging society, and that will affect their practices in many different ways. We have a lot of work to do in terms of changing our healthcare system to align with the needs of an aging society and then preparing our workforce.